All right, picture this. You're at a crowded, incredibly loud apartment party. In one corner, you've got William. He wanders in, looks around, but he definitely doesn't stay long. He starts telling people that the negative forces in the room are deeply unsettling to his psychic soul spot. Honestly, the few guests who even try to chat with him just end up feeling super uneasy. He comes across as this aloof space cadet, and before you know it, he just slips right out the door. Now, across the room, there's Sherry. She parades in, already drunk, and just keeps drinking. She's laughing way too loud, aggressively flirting, and swearing undying affection to guys she literally just met. But then, out of nowhere, she gets into a violently explosive argument with a guy just because he took too long to grab her a drink. She storms off, locks herself in the bathroom, and actually attempts to swallow a bottle of aspirin. Her friends are outside begging her to just go home, but she is utterly terrified to be alone. So, what exactly is happening with William and Sherry?
Welcome to The Explainer. Today we are diving deep into the fascinating and honestly sometimes tragic psychological territory of personality disorders. Beneath the predictable surface of everyday life, we are all operating on our own unique wavelengths of thoughts and feelings. But what actually happens when those totally normal human personality traits harden into inflexible, destructive cycles? Well, that's exactly what we're going to unpack today. So, here is our roadmap. Number 1, when traits become disorders. 2, exaggerating the big 5. 3, the core 6 disorders. 4, nature, nurture, and pathology. And finally, number 5, finding hope through treatment. Grasping these concepts is absolutely crucial for navigating the friction of our modern lives.
Okay, section 1, when traits become disorders. We really need to define exactly what separates a quirky, flexible personality, someone who's just a bit shy or maybe a little dramatic, from a rigid clinical disorder that literally ruins relationships and careers. The real defining feature of a personality disorder is that it is deeply, deeply embedded in a person's sense of self. Clinicians have a word for this: egosyntonic. It basically means that the affected individual views their own destructive behaviors as completely normal and entirely justified. They lack insight, so instead of looking inward, they constantly blame outside circumstances, or you, for their recurring failures in life. And because these patterns stay locked in over long periods, an unrecognized personality disorder can silently sabotage collaborative environments. On a modern college campus or in an office, this might look like a total, absolute inability to accept constructive criticism, or maybe extreme paranoia during group projects, essentially turning shared spaces into battlefields. Moving to section 2, exaggerating the big 5. It is so important to understand that personality disorders are not some alien disease that you suddenly catch. Rather, they're simply normal human traits with the volume dial turned all the way up. To wrap our heads around this, scientists use the 5-factor model, which you can remember with the acronym OCEAN: openness, conscientiousness, extroversion, agreeableness, and neuroticism. In modern dimensional psychology, a disorder is just a dangerous exaggeration of these everyday domains. For instance, an extreme, rigid elevation in conscientiousness degrades into crippling perfectionism and absolute workaholism. On the flip side, someone showing a severe lack of agreeableness, scoring incredibly high in antagonism, can display some seriously reckless, manipulative behaviors. Whenever their fragile ego is threatened by a poor grade or a minor social slight, this imbalance triggers intense, displaced aggression. Section 3, the core 6 disorders. While human personality is wildly varied, psychopathology experts have actually streamlined the diagnostic model to focus on the conditions that cause the most severe, measurable damage in people's lives. For the DSM-5, experts proposed retaining just 6 core personality disorders that have the absolute strongest empirical support: borderline, antisocial, schizotypal, avoidant, narcissistic, and obsessive-compulsive. Now, being able to identify these specific patterns is a real game changer. For institutions like colleges, measuring the severity of these 6 core disorders helps them predict safety risks and ensures that struggling students get targeted mental health interventions before interpersonal friction blows up into a major crisis. To give you a clear picture, let's take avoidant personality disorder. People dealing with this exhibit a pervasive pattern of profound social inhibition and deep feelings of inadequacy. It's essentially the volume turned up to the max on introversion, paired with an agonizing hypersensitivity to any negative evaluation. It's incredibly painful for them.
Now, contrast that painful withdrawal with antisocial personality disorder. This condition is characterized by incredibly high antagonism and low conscientiousness. Individuals here can be calculating, highly manipulative, chronically untruthful, and display a chilling, callous disregard for the rules of society and the rights of everyone else around them.
So, bringing the signs right back to our opening party scenario, remember William? He withdrew, complaining about negative forces, and came off as a total space cadet. Well, that perfectly mirrors schizotypal traits, high introversion combined with highly unconventional, eccentric ideas and social discomfort. Meanwhile, Sherry's volatile, self-destructive acting out, her dramatic emotional swings, and her absolute sheer terror of being left alone perfectly capture borderline personality disorder. This brings us to Section 4, Nature, Nurture, and Pathology. How do people like William and Sherry get to this extreme point? We really have to explore the root causes, the incredibly volatile mix that creates such deep-seated pathology. It's an intensely high-stakes interaction between the biology we inherit and the environments we grow up in. Take borderline personality disorder, for example. A child might inherit a severe genetic vulnerability to emotional instability. But here's the key. That biology only becomes pathological when it's paired with an invalidating, abusive family environment where their emotional outbursts are constantly punished or mocked. Because of that environment, they simply never get the chance to learn healthy emotional regulation. The great psychologist Abraham Maslow hit the nail on the head when he said, "What is necessary to change a person is to change his awareness of himself." Tragically, individuals raised in highly unstable homes experience profound emotional dysregulation that persists for decades. We see this all the time in college or the workplace. Unrecognized childhood trauma suddenly surfaces as a total emotional collapse under the pressure of a tough class or a big project. The crises we witness in boardrooms are so often just delayed expressions of childhood trauma crashing into genetic traits.
Section 5, Finding Hope Through Treatment. Now, because these behaviors feel entirely normal to the person experiencing them, remember that word egosyntonic, they are historically very tough to treat. But despite these traits being deeply woven into the self, effective, life-saving treatments absolutely do exist.
Real treatment begins with a profound philosophical shift. Carl Rogers beautifully stated, "The curious paradox is that when I accept myself just as I am, then I can change." This paradox is the literal foundation for treating conditions like borderline personality disorder, where patients experience such immense emotional pain that it actually motivates them to seek help. Therapists have to walk this delicate tightrope, balancing radical acceptance of the patient just exactly as they are with a very firm push for necessary behavioral change. This delicate balance is perfectly realized in dialectical behavior therapy, or DBT. Created by Marshall Linehan, DBT is a premier, empirically validated treatment protocol. It's an amazingly structured program that brilliantly combines traditional cognitive behavioral science with the acceptance principles of Zen Buddhism. It is specifically built from the ground up to help patients who are navigating immense emotional pain. Let's look at how this builds a real path to recovery. Over the course of a rigorous year of therapy, patients systematically acquire 4 essential life skills. They learn mindfulness to stay present, distress tolerance to actually survive a crisis without making things worse, emotion regulation to understand and manage their wild feelings, and interpersonal effectiveness to communicate their needs while keeping their self-respect intact. It is quite literally teaching individuals how to finally reach over and turn that extreme volume dial of their emotions back down to a manageable level. Marsha Linehan herself offers this incredibly empowering reminder to anyone suffering. We are not trapped or locked up in these bones. No, we are free to change. It's a powerful testament to the fact that with the right tools, absolutely no one is permanently locked into a world of profound psychological pain. Healing is for sure possible, even when the disorder feels like it is your very identity.
So, here is the crucial takeaway from all of this. If learning to manage intense emotions through tools like DBT saves lives in a therapy room, imagine how universal these skills could be. Why wait for a clinical diagnosis? If we all face the high-pressure friction of modern life, the anxiety of academics, and brutal relationship conflicts, shouldn't distress tolerance and emotion regulation be taught to everyone? Think about it. How much smoother would our workplaces, our schools, and our personal relationships be if we all just knew how to turn down the dial on our own hardest traits?